I'm Dr. Michael Yunaev. I'm a Sydney-based Oncoplastic Breast, General and Cosmetic Surgeon. I'm also a Principal Surgeon at Breast and Body Clinic. We have a number of clinics across Sydney and New South Wales and would love to see you here. I've completed, in fact, 3 surgical fellowships, one in general surgery, one in oncoplastic breast surgery, and subsequently aesthetic breast surgery as well. I've taken some time to do some academic work as well, completing a master's degree in breast surgery as well. The field of breast surgery has changed dramatically in the last 10 years, even starting from the days when I was training as a registrar and this time now. The approaches taken by surgeons are completely different because the aims of the surgery have changed somewhat as well. It's no longer sufficient to just cure a cancer. We also want to make sure that our patients have great aesthetic results, confidence in how they look, and are free of problems down the track which can occur with some of the oncological surgery, such as congenital issues or asymmetry or breastosis. All of these things are really quite common. We do use techniques. For instance, we use supporting materials that we use in breast reconstruction. We often use that now in our patients for aesthetic surgery. The technical materials that we use, in fact, have come from one field into another as well. The kind of implants that we use for breast augmentation and for breast reconstruction has changed dramatically, and that's come about from the developments in both fields that have shown that newer implants these days certainly do better on many fronts, and one of the important things is infection, implant contractures, but also other new things such as breast-associated lymphoma, which is a rare condition we'll talk about. Our aesthetic range of procedures includes surgery focusing on the breast and the tummy. The breast procedures that we perform include breast augmentation, breast reduction and breast lift surgeries, but also more complex things such as revision surgery for complications from breast implants or just normal breast revision for patients who've had previous breast implant surgery. We also look at more complex scenarios such as breast asymmetry or congenital breast problems such as tuberous breast, which is always a technical challenge, to be honest, and that's what we focus on. In terms of the tummy, one of the most common procedures that we do is a tummy tuck. This is aimed at a range of patients, but very commonly done as part of a mummy makeover. This is a procedure whereby a woman can regain her confidence after having children. Often it's multiple children, and that can have quite a significant impact on the patient's body, both breast and abdomen, and this is something that can be dealt very adequately with this procedure, the mummy makeover. We also offer a liposuction service. This is again often done as part of the mummy makeover, but not only, it can be done separately. And this is a very useful technique that we utilize to fine-tune our results from the tummy tucks and breast reduction or augmentation. My main motivation is to help our patients to both feel confident again and feel comfortable in their day-to-day surroundings, to try and repair any of the issues that may occur as we lead normal daily lives. I'm accustomed to dealing with patients who've had serious issues such as cancer or other benign problems, but I also am aware that aesthetic problems with breast or abdomen can have just a dramatic impact on them, particularly mentally and psychologically, and I think that is just as important in trying to correct that or improve that for the quality of life of our patients. And this is what it comes down to at the end of the day. I believe that aesthetic surgery is not just about the physical aspects, but it's also about the psychological and the mental aspects. Sometimes can contribute quite significantly to the quality of life of our patient. I think when a person is thinking about having a cosmetic procedure, it's important to realize that any surgery is surgery. You do need to do your own research to figure out, first of all, what do I need to do? What do I want to do, and who do I want to do that? All of these components are important in determining the success of your procedure and minimizing the number of potential problems or complications. Selecting your surgeon is probably one of the most important things that you need to do in terms of deciding whether you proceed with your surgery. Having a surgeon that firstly cares about the results that you get, cares about any problems and is prepared to look after them, but also importantly is experienced and the necessary expertise is what you really need. There are a number of clinics out there that specialize in a particular procedure and provide a one-size-fits-all operation. It doesn't really take into account many of the intricacies that come with individuals. And what we need to do as patients and doctors is to stress that we are all different and that we can modify things as necessary in many of these instances.